Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to our fourth edition of Not Just a Dog, honoring hope and healing, recognizing the caregivers to celebrate National Doctors Day. And as we know, for this month we are celebrating National Doctors Day, which was on 1st of July. So to celebrate this day, we have with us Dr. Koshy Mathew Panicker, Consultant General Surgeon at SUT Pattom Hospital. Welcome to our show, sir.
Hi, good afternoon. I am
Yeah.
Dr. Koshy Mathew, Consultant General Surgeon in SUT Hospital, Pattam, Trivandrum.
Thanks a lot, sir, for joining in for this conversation. So this year we are celebrating the fourth edition of Not Just a Doc, which is an extraordinary celebration dedicated to showcasing the remarkable efforts of our doctors and expressing our heartfelt appreciation for their selfless service. As we know how much of dedication, hard work you guys put in to treat your patients, to make that difference and to make your patient heal as soon as possible. And to appreciate, to value that dedication, we have come up with this kind of initiative where we want to know a doctor beyond their profession and want to know what are they liking and disliking and want to celebrate them as a person. So without delaying this, I
Yeah,
would like to
actually,
know. So
yeah, continue.
without delaying much, I would like to know your views and your liking and disliking everything. So what inspired you to pursue a career in medicine? And how do you balance your professional life with personal interest and hobbies?
Many medical professionals, including me, are inspired to pursue a medical career due to the desire to help others in their complex situations and to be a part of their uh, illness to solve them with the critical times. And some of us have inspired from our family members itself, or maybe just a childhood injury which the person would have gone to the hospital and got inspired by the doctors who have treated them. Likewise, and from my part, I got inspired from my grandfather, who was a physician assistant in late 1950s. And balancing a professional life and the personal interest, we have to maintain a crucial steps by prioritizing the self-care, set boundaries, schedule downtime, take breaks, and practice time management. And these are the ways we are keeping our day forward to the next. Yeah,
Yes, so I think the cause, the inspiration matters a lot, whatever path you pick up, and if that is strong, then yes, that pushes
yeah,
you to reach it.
yeah.
So
Yes,
we know
that's
a
a valid
doctor's
point.
life is we know that a doctor's life is not easy, and it involves a lot of struggle, lot of focus, concentration, attention to the work you're doing. So after a long working day, how do you unwind yourself, and what do you enjoy most about your downtime activities?
Unwinding after a long day, that's a big question. After work includes time spending with the family, maybe listening to music and meeting friends. And for my part, meeting friends and to spend time with them is the most important, so that I can be spending that quality time with them. And the downtime, it originates for the next day challenges.
And I think, sir, that me time is required a lot so that you can relax and recharge yourself for the next hectic day.
Yeah, yeah,
So
yeah.
there must be a person or something which would have been an influence outside your medical field. So, who or what outside of your medical field has been a significant influence in your life, and how has this influenced your career?
Actually speaking, to pursue a career in medical professional, my grandfather, as I said, was a physician assistant in 1950s with the British doctors, and his kindness and the strength was a significant influence in me to take the career in medicine. And his compassion and empathy to the patients who was treated by him, and the stories uh, which was told to me by my grandfather was a great inspiration for my career. And outstanding other professionals, I can mention two of the doctors: Dr. Somerville, who is a British doctor who served in India in my local town in Kollam, in London Medical Mission Boys Brigade Hospital. He was there in our India from 1923 to 1950, where he have written a book also, Knife and Life in India. And the other personality which influenced me to the career was Dr. Ida Skirder, who was the founder of CNC Vello, who is an American missionary who started the missionary works and medical schools in India during the plague, cholera, and leprosy times long back in India. And these two eminent personalities was uh, very much influenced me to take the career in medicine.
And I think, sir, that person who has influenced their life or who is continuously a role model shapes our way, shapes our path everywhere, whether we are
Yeah,
professionally
yeah,
doing something or personally, because that becomes an inspiration for our life. And we always
yes,
look up to them for
mm,
everything, for every problem we are facing.
yes, yes. And
And
long back, the medical
yes, sir.
school was not open for the females. That was started by Ida Skirder in Vellore, and that
Hmm.
came the pathway for the females to get in the medical career.
I think their work done inspires a lot. The way they do this.
Yeah, yes,
So,
yes.
lastly, we know being a doctor is not easy. You have to be on your toes every time. But still, what do you enjoy most about interacting with your patients on a personal level? And how does this enhance your medical practice?
Uh, Connecting with the patients on a personal level allows me to understand their stories and to provide more empathic care, making my practice more rewarding and fulfilling. And interacting with them makes me a person in their family itself, and they can speak out their worries and problems straightly. So I like to interact with my patient personally also.
And I think that
Yeah,
that helps you to understand more about them and then treat them in a better way.
yeah, that's the main thing. And they consider me as a part of the family itself.
Yeah, I think that that feeling, that trust to have, to feel that doctor is part of our family, he's there to help us, support us, and they can rely on a doctor. That trust they have built in you, that is the most important part, that you guys are doing tremendously well. And thanks a lot for all your service you're providing for the people out there, for the society, and your continuous hard work. We appreciate that lot, and our gratitude is always there for this, sir. And thanks a lot, and congratulations again on National Doctors Day, and thank you for taking your time out for this conversation where
Mm.
we could know more about you beyond your profession.
Thank you very much.
Thank
Thank you. It was a nice talk, and uh, thanks for